Hey guys, my name is Amanpreet Singh and welcome back to Dental Secrets. Today we have Dr. Adam White. He has a channel on YouTube called Beyond Dentistry. If you haven't heard of it, I would definitely check it out. It's a ton of great information for general dentists and people who just graduated dental school, so I would definitely check that out. Today we're going to talk about a lot of cool stuff, so definitely stick around till the end. But before we get started, make sure you hit the thumbs up button and subscribe to our channel below. Let's get into it. Adam, thank you so much for being on my channel today.
Thanks for having me.
So, Adam, I know you graduated in 2011 from dental school. So you've been practicing for about 10 years, right?
Right.
So you're pretty experienced and, you have your own practice. You've kind of seen a lot of things and you know how the real world is versus dental school. So my first question to you is, what is something that you know now that you wish you knew when you graduated dental school?
Oh man, that's a great question. There's so much. It's hard to answer that in like one piece. Dental school was really interesting third and fourth year because like going from like kind of second to third year, everything was super by the book. So you have these
Mm-hmm.
instructors that are kind of like, you have to follow every step perfectly. And then eventually you get into fourth year and you find these instructors that kind of start letting you cut corners and like this is how it works in the real world sort of thing. I think, and this is going to sound backwards, but a lot of my headache the first couple years was kind of taking some of those shortcuts on like dentures or something like that. Like still, even today, the best dentures I've done are ones that I just kind of followed, the way that we learned to do it second year. And it's you learn that actually if you take like a lot of the CE stuff like Dawson Academy, I did some of that, and they are very meticulous as well. Like it's not cutting corners and not saying that, you have to do every step by the book, but it definitely it helps to slow down and like put that quality first and then the speed sort of comes after that.
That's interesting. I recently graduated, and I know in dental school we heard a lot about in the real world where you do
Yeah.
dentures in 2 or 3 appointments. In dental school, it's like 7 appointments. So I was always waiting for that point where I can just learn how to do dentures really quickly. And then I started working, and I physically did not know how to do dentures that are quality in
Yeah.
that short time frame. I'm still doing like the same way I learned in dental school. So
Yeah.
that's interesting to know now that even after 10 years, you're still find it's the best way, like doing it how you learned in dental school.
I kind of modified it a little bit, but it still takes almost as many appointments. So what we do is we've got a decent set of like stock edentulous trays. And
Okay.
so I'll do an alginate right away and pour it up almost as if it were going to be a master cast. We get the wax rim back, do all the wax rim stuff, then do the try-in. And then almost every time at the try-in, I'll go through and reline the wax rim. So I'll actually border
Okay.
mold then. So like you border mold the wax rim like with the teeth in it, and then take a light body wash or even medium body, and then that's the new final impression. So I've kind of
Okay.
modified it a little bit, but it still does take some steps. It's not just take alginates and dentures come back.
So you're basically using that as your custom tray as opposed to.
Exactly. That's a good way to say
Okay.
it. But yeah, exactly. I've never really gotten burned with that. Sometimes they're a little tight, which sounds kind of like, oh, it's a good thing if it's denture and it's tight. But
Mhm.
a lot of times, like they fit super good when they come back, but then you have like more adjustment appointments than you think you would need.
So, what would you say is the biggest hurdle for a general dentist and they're just starting their career? They just graduated a year or two ago, or even this year, and they have no clue what to do. Should they work corporate? Should they work here, or should they start taking CE courses? What would you say the biggest hurdle is for a younger general dentist?
Oh, I think without a doubt, I think for most general dentists, it's going to be student loans
Student
because
loans.
I think student loans, and I know that's not 100%. It's not everybody. If you're going into a residency, it doesn't. I mean, it matters, but it doesn't matter right then because those will get deferred. If you're in the military or you're fortunate enough to come from a family that can help you out,
Hmm.
you don't have those same issues. But I think for the average dentist, when you come out with $400,000 in student loans, looking at how you're going to pay that back, that's a challenge because whether you think of it or not, it does influence every career decision that you make. And then you're kind of another thing is how fast the landscape in general dentistry is changing with insurances. And as a concrete example, going into private practice in 2012, up through like throughout history, up through about 2015, the insurances would kind of bump up the reimbursements every year. In about 2015, they stopped. So it's interesting. We're getting like the same insurance payments now that we were, 7 years ago. And I don't really see an end to that. And it's not like, everything else is cheaper now. Costs go up, payroll goes up, rent goes up, but those insurance reimbursements don't. And so that's another challenge. Because if you're an associate and you're getting paid a percentage of collections, not production, then that does affect you too.
Yeah, for sure. And that's all ties with the, I think, inflation, right? That's
Yeah, 100%.
printing more money now, and then cost of everything is going up. And I don't know if you saw recently, Cigna lowered their insurance reimbursement.
I saw that in some places. Yeah,
and that's crazy because you're expecting things to go up,
yeah,
and you
and
want
then
to
they go
charge
down.
more to get the same reimbursement, but how do you even like handle something like that?
Yeah,
So,
right.
I guess going off of that, do you still think dentistry is worth the cost to entry? Because dental school prices they're sky high right now, and
Yeah,
they're
for
only
sure.
going up.
Yeah, for sure.
And student loans you can never file bankruptcy on student loans,
Right.
and it's just a mountain after you graduate. It's very intimidating.
Yeah,
What do you
absolutely.
think about that?
Yeah, that's really a great question. I think it's still a good career. I think it's always going to be a good career. So I'm going to say like all the good stuff about it first.
Mm-hmm.
I know people in other fields that are similar that feel the same way about their fields. So I know people in medicine that look back and say, "Oh man, that wasn't worth it. I should have gone into
Mm-hmm.
something else." People in pharmacy that say the same thing. And so I wouldn't rag on dentistry as being like uniquely among the healthcare professions something that used to be good and it's bad now. Um, I think dentistry used to be like a no-brainer. If you graduated from dental school in say 2000 to 2005, you come out of dental school with $100,000 in debt or 150, whatever it is, and you can go make, even starting out 120-ish, and then, those are the guys now they're set up really like the ones that invested well. They're set up incredibly well
Mm-hmm.
for retirement. So you can have a career like that and really, some of these guys have like a $5 million plus portfolio because they were just really diligent with
Mm-hmm.
saving and all that kind of stuff. I don't see dentistry ever being that type of profession again, but I don't know that there are that many professions out there like that. So as far as is dentistry worth it? I did a video on that and it got a lot of like positive and negative. I'd have to update some of the numbers because I think the starting salaries are probably a little higher, especially now than I would have said at that time. Um, Even still, I think it's pretty slam dunk. Like if you look at it from an investment perspective, if you have to take out a loan at those rates for the career, it doesn't make sense financially. But most students are going to be on income-based repayment. And so if you're like really diligent where you're saving, you pay, I think it's like 10 to 15% of your salary, and then you save toward the tax thing at the end, then you can strategize and plan that way and it can still work out well financially doing that. And now you have to, be confident that they're going to forgive it and all that kind of stuff.
Mm-hmm.
Um, where I would really caution against jumping into it, at least before knowing what you're getting into, is somebody that thinks like, say you want to, someday you want to start a family. So you want to be like a stay-at-home mom or a stay-at-home dad, some point down the road.
Mm-hmm.
It's a really hard career to work, 5-10 years in, and then decide you want to do a day or two a week. Because it's kind of what they, the term golden handcuffs. Oh, they're
Mm-hmm.
not, it's not always about luxuries. It may be about, having to service that student loan debt, something like that. So, it's, I think it still is a good profession. I think across the board, all professions are especially in healthcare, are sort of not, not quite what they used to be. And dentistry is certainly no exception to that.
Yeah. I do appreciate you making a video like that because, most people say don't worry about the money, just do something that
Yeah.
you love. But you have to worry about the money because
Oh, 100%.
when inflation's kicking in, you have to know like how to support your family, how to live like a lifestyle that you want, right? And
Yeah.
that's important to talk about when you're going into dentistry because you can't just think, okay, I'm making this amount of money, I should be good to go. But that's nearly not how it is anymore in dentistry. So, and going off of that, if I know you own your own practice, right? Do you own the building as well?
I don't own the building. No,
Okay.
I have a
Okay.
landlord.
Okay. So, but still, owning your own practice is another way to increase your income, right? But it comes with a lot more stress.
Yeah.
Well, do you still think the future of dentistry, let's say like 5, 10, 20 years from now, is viable to start your own practice from scratch or buy a new practice? Because what, like something we already talked about was insurance companies
Yeah.
and how the last 5 years they have not been increasing their reimbursement. And we talked about Cigna, how they actually lowered some of their reimbursement. And now we have corporate companies that are basically taking over this whole DSO structure that's taking over and accepting these insurance companies that no one really wants to accept.
Yeah.
So to me, it looks like the future of dentistry is leaning more and more towards corporate, and it's basically inevitable. But if you're starting your own practice, you have to kind of look at a time frame of when you want to sell or how long you think it's going to be worth it to own it. And I guess my question is, what do you think the future of dentistry is? Do you think it's still going to be the same? Let's start up a new practice and it's still going to be viable in 5, 10, 20 years from now, or do you think it's going to be a different phase of dentistry?
Yeah, that's a really good question. I go back and forth because I've thought about it, kind of like you. I've thought about it a lot. If you look back into, I think it was the 80s, they started trying to put dentists in Sears, which like Sears was kind of, the closest thing to Walmart back then. And I noticed, there's dentists, like I think it's some Walmarts in Georgia are starting to put dentists in there. It's just not the same thing. Like you can't do with dentistry what you've done with optometry because
Mm-hmm.
optometry is and optometrists will tell you this, their bread and butter is selling frames and lenses. They sell glasses, that's how they make their money. They don't make a ton of money on exams, where dentistry is a procedure based thing. I don't think that model really works well. No one's ever figured out a way to do it where it's like a really bottom of the barrel, like it's in a Walmart corporate kind of setting. I think it's going to be really tough to do that. um, the other end of that spectrum, though, if you're like me, I'm a solo practice. I'm open 4 days a week. So I have all these, I have two autoclaves and all these chairs and, all the, a server and all this equipment that's just not getting utilized most of the time. And if you look at, anything throughout history of the economy, things tend to get more efficient because that's market forces. And so I could envision a scenario where, it looks more like a space sharing thing. So instead of, just me in my office, maybe it's me and then another dentist works, the evenings or something like that. Um, so I could see a trend toward more groups. I think it depends a lot too on the area. So it's going to happen in the bigger cities before it'll happen, in rural areas. Um, the insurance thing is really interesting because I think it's almost to the point where something's got to change, something's got to give. Because I mean, as a concrete example, I know of a dentist who said he um he had a practice and he actually shared his building with another dentist, and he brought in an associate, bought the other practice when that dentist retired. So he was basically like, I'm going to double the size of my practice but bring in an associate. That associate left, so then both practices were all on his shoulders. So he said, you know what, no insurance. I mean, like no insurance to the point where patients, like, they file their own insurance claims and stuff like that. I mean, it's really
Wow.
like, I am not touching insurance, thinking that he'd get all kinds of attrition. And he lost a couple patients, but for the most part, his practice is still like way too many people for him to handle, from what I
Wow.
understand. And so when you see trends like that, like I think something's got to give with insurance. Either they're going to have to bend a little bit, or there's going to be a lot more where like people pay out of pocket and then just use their insurance benefit. As far as, what does dentistry look like in 5, 10 years? That's a really great question. I think there is always room for a private practice. I think it might be less and less in bigger cities and stuff like that. I think as, and not even necessarily a bad way. I think as DSOs compete with each other, they're probably going to have to get better. I mean,
Mm-hmm.
I know some of these next generation of DSOs have a lot better reputation than some of the first ones, where they're,
For sure.
upselling everything. And so yeah, I'm not sure how that's going to play out. I'm as interested in any as anybody though.
Yeah, that is interesting. That friend that you're talking about is So does he basically? I don't know if I heard it correctly, but he has the patient pay up front, and then they file the insurance claim themselves. So the practice that he's working at never deals with the insurance.
Yeah,
Is
it
that
and I believe that with some insurances they require that. And so I know that there are insurances out there that like if you're not in network, they won't even let you file the patient. And that's it's
okay?
really kind of a tactic that they use to incentivize you to be it because it's really easy for us to file a claim. So if I said to a patient, yeah, we're out of network, but we can file your claim for you, some of those insurances will not allow that because it's almost too convenient for the patient. They'd rather see their patient go into like an in-network office.
Yeah, yeah, for sure. And that's interesting that you talked about like depends on the location, right? Demographics are very
100%.
important.
Yeah.
If you practice in a big city, it's definitely going to expect changes a lot sooner versus in a rural area where you know corporate places probably won't be as much of a thing for a while. And so how did you choose your location for your practice?
For me, it was kind of I'm like a hometown guy. Like my family, it's funny. Like we didn't plan it this way, but like my mom and dad are like my backyard neighbors. So it's just, I still live in the same town I grew up in, that sort of thing. So really I didn't have any great prospects for private practice. And I really liked the community health clinic that was in the area. So I got a job with them for a year. And then in that year, like a month or two into it, I started talking to a broker and really just looking at practices in the area. And then this one opened up and that's how we ended up there. So it's really like kind of a boring story, but
No worries.
the long story short is like my wife and I knew we wanted to live close to home and
Hmm.
get a practice within driving distance, and that was kind of it.
So if you had to start all over and start a new practice today,
Yeah.
and you had to choose, some location. I know you're from Michigan.
Yeah.
Um, what would be your driving forces? Would it be like more rural area, or would you look at big businesses in the area, or what would be some things that you look at?
That's a great question. I am honestly not I don't know much about startups. I actually have
Okay.
two friends that are specialists in their they each did startups, one in pediatric dentistry and the other one in orthodontics, and they're both doing really well. As far as general startups, I think the people that I've seen do it successfully, it's just kind of it's like where is growing,
Hmm.
what areas are growing versus declining. I think rural can go a couple different ways. I really think you have to be wired for it. And I do know some people that are wired for it. They want to live on a farm and all that stuff. And then they're also, the dentist in the town and they're making,
Yeah.
300 grand because they're the one dentist there and they're
People would drive 50, 60 miles for that one
exactly.
dentist.
Yeah, exactly. I know, for me, the town I'm in, it's a town of 5,000 people, but there's, I'm pretty near some other bigger areas. So I wouldn't go out like 2 hours into the sticks. I
Hmm.
think that I think it's more like, I think it's more like what drives you. Cause I know a lot of people that like their idea of success in life is the most successful dental practice there is. And if that's, if you're wired that way, that's awesome. You can look at, what's going to make me the most money. And I don't think there's necessarily anything wrong with that. But if, doing some soul searching, if it's like, yeah, that's important. I want to make some money, but I also want, my kids to have good schools and, et cetera, go down the list of things that are important to you. Then I think if you chase that like golden egg of, the most profit somewhere, then
Hmm.
you could do that at the expense of some other things that are important to you.
So let's say you're looking for a new job as a dentist. There's a few options. You can work as an associate for a private practice. You can go into ownership and buy out someone else's practice, or you can work corporate. Do you have an opinion on those three sort of ways of working as a dentist, or do you have like, there's also like FQHCs and other stuff,
Yeah.
obviously, but what is your opinion on those three, and like, do you have some experience in those, or
I've never worked corporate, so I don't have
okay,
a great answer for that. And I actually don't corporate's not huge around our area. There's
okay,
Aspen. We have a couple Aspens, and other than that, I don't know too much about it. I think corporate is it gets a bad rap, and I understand why. They're really aggressive treatment planning and stuff like that. The one thing corporate does have is a steady pool of work, at least, because I've seen some of my friends go into an associateship, for 2 days a week, and they can't stay busy for even those 2 days, something like that. Um, I really like FQHCs if you get into the right one, because it, the first thing, and I'll just go by my own experience. Everyone is different, but like I had a great dental director, so he knew like when you're out of school, you're fresh. They started you off for the first month or so with like a really light schedule, knowing that you're kind of just learning as you go, and then kind of ramp your schedule up over time. Um, it was just salary, which was kind of nice. There was no production, no bonuses, anything like that, so it was really
Hmm.
predictable. Health insurance, all of that stuff. Um, I think that it was a really good spot starting out. I think if you know you don't want to be there forever, then it's important to have some kind of exit strategy. Like I'll stay at the FQHC for this many years, and then I'm gonna, go work for somebody else or ownership or whatever. Because the first day of your job is probably very similar if you've been in it for 20 years. There's not really,
Yeah.
you're not going to learn, you're not going to go take a bunch of implant CE and then be able to come back and do that. I mean, it's
Hmm.
really, it's basically extractions, dentures, some fillings, a lot of pediatric stuff. Um, some where I was, we did some root canals because like Healthy Kids in Michigan covers root canals. And so like if it was 21 and under, we'd generally be able to do root canals there, but that was
Okay.
about it. So I like FQHC. It was kind of low stress where I was at, which was nice. But I know they're not all like that. So I wouldn't like across the board say like that's going to be everyone's experience. I think
Okay.
the question of ownership, I was really like, I started talking to brokers fourth year of dental school, like I want to be an
Oh
owner.
wow.
And looking back, I think I would have backed off from that a little bit. And even in my own practice, may have taken a couple more years to kind of decide, what's this ownership thing look like? Because there's a lot of benefits to ownership, but you sacrifice a lot of agility to be able to do that. And
Hmm.
so I
Interesting.
don't have, I don't have an associate. I don't have anybody that, I've never taken like a long vacation because you kind of feel like this is your baby. If something, patient needs something, you have to be there, and you can ask other dentists to cover for you. But or say you have a spouse that works in tech or something like that, and then your spouse gets a job and amazing job offer in Seattle or something, and now you own a practice here. So there
You're
that
tied down. You can't. Yeah. That's
exactly, yeah. So it really, you do lose something by owning, and so I see the value. Like if you are happy as an employee with where you're at, the long term, prospects of it, you're making good money. I don't think that like ownership has to be this like you missed out on something in life if you never owned. Like I think the job can be a good job, even as an associate.
that's good to know because I feel like a lot of people are pressured to get into ownership, or when they're working as an associate or just an employee, they feel like they're not taking the next step where they eventually need to.
Right, yeah.
It's because I don't know for you, but for me, everyone is like, the first question they ask me is, "Are you going to buy your own practice? Are
Hmm.
you going to be going to ownership?" And it's like kind of the stigma, you graduate as dental school, you're going to own your own practice. That's just kind of like a given. But some
Yeah.
people don't want to do that, so that's cool to hear you say that and those opinions on that.
Yeah. I think too, and I didn't really appreciate this, but like when you're that aggressive in undergraduate and dental school, like you're living and breathing your future career. And you don't have a lot of time, at least I didn't, to sort of do that soul searching and understand like what you want out of life, what a successful life for you looks like. And if you get on that treadmill of like next thing, next thing, next thing, I think it's easy to jump into what you think is going to be that next step, and you can make it work. It's not necessarily a bad thing, but there's I think there's also something to be said for like taking a couple years, finding out like who you are, what's important to you in your life, and kind of making decisions based on that. Like I remember there's a guy in Dental Town that worked, I think he may have been doing this for almost since he graduated, but he worked 2 days a week, maybe even less than that forever.
Mm-hmm.
He made 60 grand a year and he loved it. So he would go to work like Monday, Tuesday. He's like rehabbing rental houses and stuff on the side. And I remember that when I first heard of that guy, I'm like, man, that's weird. Like I could never do that. And here I am, like, a few years after reading that, I'm like, no, I get it. Like that's important to him. Like he's way happier than he would be trying to like take his practice from netting, 180 to 200 or whatever. It's, it's different priorities for sure.
Yeah, I guess I mean, for someone like that, if you don't love what you're doing, you're going to get so burnt out doing it
Right.
5 days a week, not having time to do something that you love at home. And so it's good on him that he's actually like only 2 days a week doesn't seem that unreasonable at that
Yeah,
point. It's
right.
just you're making some more good money, that's good stable money, and then you're able to do something that you love. And then if you wanted to invest more money in that, you could, and then hopefully maybe get some return in it, or you can do whatever you want.
Right, right.
And that's cool that it kind of goes along with your channel, like Beyond Dentistry. There's more to life than just being a dentist and working 5 days a week. And so someone coming to your channel, that's kind of refreshing to see, like someone in my shoes as a dentist who's been practicing for 10 years, who's able to like look at the bigger picture and life in general and see what else is important, right? Like you got to take some time to soul searching, like you said, or just something that you enjoy.
Yeah. Yeah, 100%. I think our, in America, and we're, I think there's historically we've had the most productive economy and generated some of the best, work ethic and, et cetera, et cetera. But I think the other side of that coin is we get really hyper focused on economic production, and we tie our value as human beings and what we're giving to the world with how many dollars we can generate. And
Yeah.
that's, and I wish I had more answers than I do. Like I'm definitely have more questions than answers compared to 10 years ago. But I think one big thing I've learned for me is like that economic success is not as, I say it's not important. It is important. It's not, it doesn't fill all the gaps that I thought it
Mm-hmm.
would. Like there's a lot of stuff that I have to work on intentionally that have nothing to do with that. That if I, neglect those areas, it's bad. And again, for me, like I'm not saying this is anybody else's path or like anybody else's priorities.
Yeah, no, I totally understand that. They say money can't buy happiness,
Yeah.
right? But the way I look at it is, my goal with making a lot of money is, or to hopefully make a lot of
Mhm.
money is, to be able to give back to my community and
Yeah.
support other people. So those are my end goals. But like the only way to get that is not necessarily the only way, but the easiest way is just the more money you have, the more you can support or do things, change ways that you want to do yourself, right? You don't want to rely on other people to be philanthropic or whatever. If you can take it into your own hands, that's how the results are going to be the best, right? So it's kind of like two ends of a perspective looking at it, where
Yeah.
you having this end goal in mind of what is a real reason that you have this money. It's not so you can buy the coolest stuff and show off to your friends, right? So
Yeah.
you can benefit the world that you're living in. So it's
That's awesome.
it's interesting hearing different perspectives like that.
Yeah. I love that, like where you're coming from with that though. Like like you said, your goal in making money is like so you can help your community. I think that's awesome. Is it like, has that always been a drive for you? Like even getting into dentistry?
Um, I think it's a mix of things where it wasn't the reason I got into dentistry, but it's kind of like in my culture and my religion actually is a Sikh.
Okay.
From northern India.
Yeah.
So just the way I was raised, my family's always been the first people to help out other people in need or something, and it's just the way I was raised. If I see someone in need of help, I always try to be the first person to help them, and I think I can apply that in really any field. Of dentistry,
Yeah.
even if you're doing like service in a free clinic or something, or volunteering your time on weekends, or anything you can do that is important to you. That it's just I think it's more of just my culture that I was raised in, but it's not, I don't think that's the only thing, because I know a lot of people that weren't raised in the same culture that have the same mindset as me, or that I get inspired from, that make me want to, do that. So everyone has their own, So
that's really cool.
I think it has a lot to do with people's upbringings too.
Mm-hmm.
Just you see someone doing something good, and you see the happiness that inspires in you and the people that you're giving it to. So it makes you want to do more, right? It makes other people want to do it as well.
Yeah.
So
it's contagious for sure. That's
exactly.
Yeah. No, I love that perspective. And I think somebody like, it's really cool to hear you say that, because I think somebody like you, like, that's such a healthy place to start from, where that desire to serve people, and it's like you said, it's part of your culture and your religious upbringing, and that desire to serve, like, that drives dentistry for you. And I think that's such a good guard against burning out, and against that kind of thing. Because if I'm honest with myself, like, one of the main reasons I went into this was like, I just wanted to make some money so I could buy some cool stuff. And as and there's a lot of charity, but it seems almost like peripheral. Like, I'll kind of live for me throughout the week, and then once in a while give time to somebody else. And I'd love to learn more about your religion. I think that's awesome. I grew up Christian, still Christian, and I think Jesus exemplified a lot of those. Like, just kind of it's other people first. It's like, I'm working for the betterment of other people, and then I'm second to that. Like, I can share in that, but it's not like, I live so much of my life and, wrestling with that every day. It was like this, it's all about me. I'm going to get what I can get. And then, like, I'll share some too, if I get enough extra. That's really cool to hear that perspective that you've got.
Yeah, no, thank you. I appreciate your perspective too. It's selfless service, right? Just doing something without expecting anything in return.
Yeah.
That's like the main pillar of my religion, which is, that's been something I grew up with and something I remind myself every day. So just hearing other people's perspective with that is it's awesome that other people think the same way. But don't get me wrong, I do like buying cool shit though. So
same here. No, I mean, the same way. It's like it's I don't know. I know there's lots of Christian doctrines on it and stuff, and I would imagine for you guys too. But like, there's always that tension of like yourself and like, how do you fit into the universe, and serving other people. And it's
sure.
not like you go live like a monk and whatever. But I'm with you though. I mean, there's a balance there. But I think that just
for sure,
where you're coming from, that's so good. Like, people need that purpose, and that's something like I feel like I'm still trying to find. And one of the biggest things is burnout, and I think that's one of the reasons people burn out, is just because it's like, why am I doing this? Having some reason is just such a cool thing.
Yeah, no, that's interesting that you're bringing up like burning out, right? Because I have a pretty good mentor still that after I graduated, I graduated during the pandemic, so we got hit really hard. My third year of dental school, the second half, I remember I just started doing cooler procedures. I was about to do my first bridge. I was about to do like these crowns to get my requirements done, and then the pandemic hits, and then I'm like, okay, I hope that I can feel like school's going to shut down. Yeah. I just hope this next couple weeks I can just squeeze by and get these patients because I really want to get these requirements. Nope, the next day is when everything hit. I remember, I forgot that basketball player that was touching all those mics and everything and spreading COVID.
I remember you talking about.
I forgot who it was.
Yeah, I know.
But I think it was the same day or the next day, and it took us a while to get back into school, and then even getting back, we were barely doing any procedures, and it was really hard to like even fill a slot in the school because everyone was fighting for it, and I would only do like 2 to 3 appointments a week.
Okay.
And as a fourth year dental student. And I'm over here just like, I need to graduate. And they lowered our requirements to the point where it was basically negligible.
Okay.
And when I say negligible, I mean like our root canal requirement wasn't even one canal of a root canal. It was one pulpectomy. I had a friend that graduated dental school but doing a pulpectomy his third year and never actually obturated a canal.
Oh, wow.
And he went out to the real world. So I definitely was looking for a mentor coming out, and my mentor, one thing he always tells me is, you are here to help the patient, right? That's, you never want to make their problem your problem.
Mm-hmm.
So if a patient is coming to you and you did everything you can to help them, you can't kind of bend over backwards and break your back doing everything for the patient, because at some point you have to tell yourself and tell the patient, like, look, this is, I did my best to help you. That's the only thing I can do. Otherwise, you can go somewhere else. And just having that in mind and that perspective, is basically, because I was under the impression where I was going to be super nice to every single patient and basically treat them exactly how they wanted. But he's been practicing for almost 40 years, and he's seen a lot of stuff, and learning from him. And I kind of see where he's coming from, because you probably see a lot of patients that have crazy demands that are basically unrealistic, right? So that's one way he prevented getting burnt out. Is always just having that perspective in mind. And I used to have those nights where I would go home and be like, oh my God, my crown prep was slightly undercut, or I might have had a void in my margin in that filling, and then, or just something like could have been even more. And I would have these nights where it just keep me up at night. And then that also, I feel like, is a big part of burnout, because you go home and sometimes I want to forget about dentistry. I don't want to even think about it anymore. So, and that's only I've been only working for 6 months. So I can't imagine you working 10 years, and I can really see how burnout happens, right? So, it's interesting having, I think it's always important to have a mentor there who can kind of guide you through stuff like that. Not just the actual clinical dentistry part, but just being able to be mindful and not get burnt out in your profession.
Oh yeah, the mentorship is huge, and that's awesome that you've got somebody like that. I would give the piece of advice that everybody needs somebody like that, but I don't think everyone's blessed enough to have somebody in their life like your mentor. Sure. And I have the same thing. There's he's a good friend of mine. He's actually a periodontist, and a couple clinical things I'll bounce off him back and forth, but a lot of it is just if I have a staff management issue, he's seen it. He's been practicing since the early 80s. Things with patients, or a lot of like you said, those little things where you're those are the moments that eat at me, are where I could have done something differently. I wish I could go back in time and do it this way instead. And that just stacking those up is kind of one of the hardest things for me to put out of your head. But again, back to the mentorship, that's invaluable. And I think as you go through your career, I still call him for stuff 10 years out. And like I said, not necessarily clinical stuff. Oftentimes it is, but just for that, somebody's seen it before, somebody's been there before. That's really invaluable to have that.
Yeah. It's similar with you in that periodontist. And I lived with 6 or 5 other roommates who were all dental students my last 2 years of dental school. And we still get on a conference call every, I would say once a week, and just talk about all the dentistry that we've been doing. And it's probably 2 minutes, like you said, of actually clinical dentistry bouncing back and forth. And the rest is just understanding we're all human, and knowing we make these mistakes. But I think dentists put a lot of pressure on themselves to be perfect, when I would say 99% of the time you're doing a great job. That 1% of the time, that 1% of the time where if it wasn't perfect, it's usually other circumstances that wasn't, part of it wasn't entirely in your control. So, if you're doing the best you can, I think that's the best you can do, right? There's only so much one person can do, right? And I don't know, what do you think about?
Oh yeah, 100%. I agree with that 100%. I think everyone's got a different personality. I know dentists that something happens with a patient, they're well, they sign the consent as part of the consent, whatever. I am not wired that way. I'm pretty what little thing could I have done differently that would have averted that problem? And I was talking to my dad about this the other day. My dad's not in healthcare, but he's a pretty mechanically minded guy. And I said, this is It's harder than I thought it would be, because like if you're an auto mechanic and you screw something up, like, oh, I ordered the wrong part, whatever it is, it's a car. It's not like somebody's health and well-being. Like this
For
idea that
sure.
I'm like somebody's in pain because I left a root tip or whatever it is. Like there's always
Yeah.
it's no, that definitely I think it, like you said, we put a lot of pressure on ourselves to be perfect. And I mean, ultimately we are humans. And I think and I understand more and more like why, you do the white coat ceremony and stuff like that, because most of the time it's really simple. Like I'm going through the steps in my procedure, and then, if it works out well, that's great. If it doesn't, it was probably something I had no control over. But there have been those times in my career where I will look back and it'll be like, I didn't do that right. Like I got to make this right with the patient. And what does
Hmm.
that look like? Does that look like redoing it for free? Does that look like sending him to the specialist and I pay for it or something like that? And because I think everybody goes through that. And there's certainly, if you're like a perfectionist, especially if it comes to something like, you could have done better, or it even,
Hmm.
lands outside standard of care, which I think is, there's a dentist that when I was a fourth year, he said something like, every dentist out there has some skeletons in their closet. Like as you go through, and I understand what he's saying, because, there are those things that, oh shoot, I should have done this differently, or whatever. And that does, I mean, especially if you care about other people and like really are an empathetic person, that definitely can gnaw at you.
Oh yeah, for sure. And I'm glad you brought up like um, doing it right to the patient. Bringing him back and um, actually making it right with them if you're not happy or if they're not happy with something. And that I think that is a really tough point in dentistry because you're kind of on the borderline. Whereas who pays for it,
Mm-hmm.
right? Like obviously there's times where the dentist will make the mistake and they're like, okay, I'll eat the cost. But sometimes the patient wasn't following your instructions correctly. Like let's say like you said don't smoke after an extraction, and they
Yeah.
go home and they said they weren't smoking, but they could have been.
Yeah.
So that is I think that's another really difficult conversation having to have with patients, right? How do you like handle situations like that?
Yeah, that's a great question. It's always an issue. I am really soft when it comes to that. So I recognize that I'm like more generous than I probably should be when it comes to that stuff.
Hmm.
I will write things off, if I feel like it's going to make things easier, on everybody, if I just write it off. Sometimes I know other dentists will say, like, they will follow to the letter. Like if a patient has an issue with a filling, they'll like bill that patient for the limited exam to come get the filling looked at and stuff like
Wow,
that.
that's crazy.
Yeah, it's, I think there's a happy medium in there. So I personally err on the side of like, to me, it's like, I just don't want to think about it. What's going to solve the problem as quick as possible. So I'm pretty, probably more so than like standard in terms of that. So like I had a lady that we could not get this denture right on, and I had gone through like two dentures, all this stuff. They were decent dentures, but in her mind it was like, no, these aren't cutting it. Like, and I could see it from her perspective. Like I look like a hack because she just hates these things. I'm looking at these as a dentist thinking they're fine. Now I could
Hmm.
go two ways. I could say these are great. Anyone who looks at these is going to think they're fine. So, you know, tough luck. Just take them. It was easier for me to just refund that and say, let's go see somebody else. We'll set you up with this guy. He's done more dentures than I have. Maybe they can make you happy. Now we'll see how it works out. And it's a lot of lost money and lost time to do that. But to me, it's like, that nobody's bad mouthing me, that I won't stand by my work or whatever. And again, you got to be careful with that, because some people are just, opportunistic, and they know you're like that. Then they will, kind of make a fuss, and knowing that you might, write something off. So you kind of, there's a sweet spot there that I'm still learning.
So do you have a lot of people that are? Do you feel like try to take advantage of that, knowing that you're more of a generous dentist? That oh, if I argue a little bit, maybe this guy will give it to me for free.
Knock on wood, I haven't, because it happens so rarely. I don't think I've had like opportunity to cultivate a relation or cultivate like a reputation as being somebody like that. Because it happens so rarely that when it does happen, it's so few and far between. And sometimes people are unreasonable. I mean, that and if that happens, then that it is certainly somebody like if we've talked through all the you're gonna hate this denture, you're gonna hate it, I'll make it, but you're gonna hate it, and then it turns out they hate it. It's like this is what it is. And so it really, I haven't had anybody really push it though, to be honest.
Well,
I
that's good. I mean,
probably will now that I just said that.
I'll knock on wood for you. Well, that's good, man. It sounds like you're, because I feel like just doing something that way will just reduce so much headaches. Right? You don't have to think about it. Just reimburse it, and then you can forget about it. You don't have to worry about them coming in and causing a scene in front of your other patients or in front of your staff, and just making a whole dilemma when you could just reimburse them and then forget about it.
Yeah, I mean, I always look at it, and it's hard because like your pride gets in the way. But like from a purely business perspective, it's like, how much would I pay to just make this go away? And then if that's within the ballpark, it's like, okay, I'm just, don't worry about it. And I mean, I know it's not a great way to look at it, but like that's one thing I've been able to do pretty successfully is like, if someone like feels like they're entitled, it's like I'd never feel the need to put anyone in their place or like, how dare they act like that to me. I was like, I honestly don't care. This is a job. Like if you need a punching bag, to feel better, I'm not in like a soft way, but it's more like I'm fine. I'm a big kid. I can handle that.
That's funny. So I had another question for you. And we did talk about CE courses a little bit. How involved should a dentist be if you're a general dentist in CE courses? Some of them are pretty expensive, and if they're battling with student loans, is it worth to keep spending money on CE courses and kind of stay up to date with everything and learn newer procedures, or what do you think about that?
That's a great question. I think right out of the gate, from my experience, the stuff that you learn in CE is really difficult to implement right away. So I know, like, I went through 4 of the 7 Dawson classes. I can almost guarantee that, most of the people in those classes are using the knowledge there, but they're not turning their practice into like a full mouth reconstruction practice, that kind of thing. 1 or 2 of them are though. So that, that is, it's certainly possible. I am a big fan, if you can do it, of doing a lot of CE early on. And I've described it like if you look at the trajectory of your career, like you have a certain amount of knowledge, you can do a certain amount of stuff. And then as you go through time, you do more and more and more. If you can get yourself on a higher level, like earlier on, then your trajectory can be that much, steeper. So it's not just a matter of, like, say you want to learn to place implants. If you learn to place implants now, then you're going to understand conversations with your specialist better for the next, decades that you're in practice. You're going to see things that you would not have seen otherwise every single patient that you see through the rest of your career. So if you do it now, you've got, 30 years to benefit from that knowledge. If you do it, 20 years from now, then you're only using that knowledge for 10 years. So I like CE. I think you have to be a little bit careful. At least I did. So like I went through the Dawson stuff. I went through the first 2 and I felt like, this is going to be me. I'm going to be this full mouth reconstruction guy. But every CE course I went to, I kind of jumped at it like, oh yeah, this is like my thing now. I'm going to, do this kind of practice. You kind of have to go into it with an open mind, but I think it is really good. The one I would recommend, right out of the gate is, do you guys have occlusion in dental school, like second year?
We took a couple occlusion classes. I think we started our second year, and then we took another one our third, another one our fourth year.
Oh, that's great. So is it like posterior disclusion and like anterior guidance?
Yeah, we learned about like TMJ, all that stuff you're talking about, like canine guidance, and we even learned about like sleep apnea and
wow,
sleep disorders, stuff like that.
Yeah.
But those were the classes. I will say those are the classes most people did not pay attention
Yeah,
in. So
that's interesting. It's so funny because that's what like Dawson and that stuff, that's where that leaps off from. I remember taking the first Dawson class and it was all like I mean, even did you guys have like the bird walks in, bird walks out thing with it was like something to do with the patterns of contacts on the posterior teeth. It was like a bird feed or
oh,
something. I don't remember
I think we might have called it something else because I don't remember a bird.
but it was something
But
like that.
I think I know, yeah. I think I know what you're talking
But it
about.
was like the same thing in this Dawson class. And I've seen, your eyes are really open to like I do a lot of occlusal adjustments now, just little things. Like I've had patients come to me that had this sore or a sensitive tooth for a year and a half. They don't know why. And I check their bite and they've got like a big lateral, interference on there. And we'll like a excursive interference on like a lower molar or something. And we'll dust that off with the diamond in like 5 seconds and they're like, oh, my bite feels better. And then they come back for their cleaning and they're like, yeah, that tooth is not sensitive anymore. You get out into,
Wow.
the real world, real world, sometimes you forget about that occlusion stuff because it's not super practical. But I think as far as CE goes, like that's a great place to start because it affects all your other dentistry. Like, I mean, it really just affects everything else because you kind of, if you try to do like procedures, I kind of back that up a little bit. If you're trying to do like one procedure at a time, I think that's tougher. But like if you want to be like if you want to get really good at implants, there's like curriculums you can go through. It's like step one, you're learning to place easy ones, and then you go back, and then you're learning like sinus lifts and stuff like that. I think that's good to have kind of a goal to aim at. But all of that being said, I don't think you need to spend, 20, 30 grand on CE to be a good dentist. I think if you always learning, even if it's like taking CE on Dental Town, they're like, I don't know, $36 a course or something
Yeah.
like that. I get a lot of stuff from those too. It's just that, um, the fact that you always have to learn. I think CE is a good way to do that. I think there's, other ways you can do that too. So if somebody says, I can't spend that money now, it's like, yeah, no worries. Like it's not, gonna hurt you at all to, learn from somewhere else.
Yeah, man, that's a really interesting point because um, one, I know occlusion is a very important thing in dentistry, and understanding like I have a couple mentors and them understanding occlusion, they basically described it how you have that it transformed their view of dentistry.
Yeah.
They even described it like they didn't even know dentistry until they learned occlusion,
Mm-hmm.
where now they feel like it just every single aspect of dentistry, whether your patient's interested in Invisalign or a full mouth rehab case, where that's always something that you're thinking about, right? So, and it goes a long way. So that's one thing I wanted to learn more about, but I just didn't know when the best point is. Should I learn other stuff first before I learn more about occlusion, or should I just get into that right away? And it sounds like you're saying it's better to start early, right?
Yeah, I probably a
Sorry.
good Pete Dawson's textbook. It's called From TMJ to Smile Design. That textbook is very, very much like what the courses were that I went through. So I bought that textbook. It was like $70 on Amazon, something like that, and started reading through it. And even then started seeing things differently, just reading, those sections on, on occlusion especially. But yeah, like you said, another good thing about CE, especially if you take it in different directions, like I took a ton of ortho CE. I feel like I understand ortho pretty well. I don't do as much of it now just because I've got such great specialists that handle it, but I do some cases. But even being able to like understand what's going to happen orthodontically when they treat the case, understanding what challenges they may run into, understanding that, what can actually be done in orthodontics before I even send them. So if I have like an adult with lower incisor crowding that has a really, resorbed root lower incisor, they're finally going to lose. Can we close that space orthodontically, or should we try to open the space to put an implant in there? Like being able to see, like just learning orthodontics doesn't mean you have to keep it all in house. Like it's actually going to make, I feel like it makes me a better general dentist, just kind of being able to see everything like that. Same with implants. I don't really place too many implants anymore, but just knowing like what's capable, what to expect when they go to the surgeon's office, recovery time, restorative challenges, like where they're going to be able to put the implant. So what I anticipate it's going to come back looking like, that kind of thing.
That's an interesting point. So, you said you don't do too much ortho now or implants, but it sounds like you did more in the past, right?
Yeah.
Why don't you do as much anymore?
Implants for me, I was so selective on cases that it just didn't make a lot of sense for me to have the inventory and
Okay.
for us to set. I mean, it's not a difficult procedure. If you're looking into implants, I can't recommend, any more highly. I think the CE class is great. It's the Angle Institute, Todd Angle,
Okay.
and I think Tim Kaczynski, he was teaching there when I went, but it's they're in Detroit. I think I know Tim is um right in Detroit, and it's a phenomenal class because it's 3 days, and so you've never seen implants before. It's 2 days of lecture, and then day three everybody places an implant. It doesn't, like, you're going to place an implant, and there's that
On a live
on a
patient
live
or
patient. Yep.
oh wow.
So they screen these patients, and then there's that psychological barrier that you walk away from that CE class from, like, I'm a dentist that can place implants, not like I have this knowledge, maybe I'll try to find the right patient at my practice. It's like, no, like, you're doing it Saturday. You're going to place an implant. You can feel what it's like in there. They're there over your shoulder. That was a great curriculum because it was like, 2 days of lecture, then you place an implant, and then they have a couple other levels if you want to get further into it. And then if you want to get really into implants, honestly, some of the best implantologists around are general dentists that just went all in that direction because they know the restorative, they know the surgery. I mean, there are dentists out there that are like dual OS prosthodontists that are probably pretty phenomenal implantologists too. But it's a little bit of a tangent there. But for implants, that's a great course. And so that's like I said, implants. I've got great surgeons, specialists that we send it to. For me, it was like, for the 10 to 20% of cases I would keep in house, it just made sense to, like, not do it. And if someone asked me to, I would do it. I have all the stuff. Um, I thought I was going to go all in that direction. And then kind of the further in I got, I felt like, I don't have the surgical skill set I don't want to start doing lateral sinus lifts. I don't want to do, some of that anatomy scares me for overdenture stuff on the lower, like those, arteries that you can run
Mental
into.
nerve and
Yeah.
yeah.
And so it's just, for me, it was easier to just say, we'll have the specialist handle it. Um, Ortho's a little bit different. I would be a little more inclined to keep more ortho in house. I kind of slowed down a little bit, like I said, mostly just because I have such great specialists. I've worked with one guy who handles everything he can with Invisalign. Like, he's an Invisalign wizard, and he's treating like kids with, class 2 and stuff, and all this stuff in Invisalign. And so we send them a lot of stuff. Another orthodontist that I know he's all in on the newer, like, airway expansion kind of things. And so we have, I'll sometimes, like, pick and choose, who I send where based on the case. And part of ortho too, like, it's a long-term, like, you're married to that patient for 2 years. And so there's, it's not just do the procedure and it's done. And so that is another thing for me. It's like, when you take a case on, like, you're committing to, 2 years worth of stuff with this case. And so there's that element of it too. Plus, we've been so busy with general dentistry stuff, I haven't really had time to, like, do a lot of ortho starts.
Yeah, no, that's a good point with because I've taken a few CE courses in the last few months, and I feel like the hardest part is, like you said, implementing it.
Yeah.
But you want to implement it right away because you don't want to lose the knowledge and the skills that you feel confident with. You want to start right away and actually use what you spent that money on.
Mm-hmm.
But I found that a lot of CE courses, they promote their own equipment or everything, or their instruments they want you to use, and they kind of make it seem like this is the only way you can do it. But the way I've been approaching them is kind of taking away, like, all these hints and little stuff and seeing how can I actually implement it in my practice, but make it realistic. Because it's not really realistic for, I feel like, most people to buy all the new equipment and train their assistants on how to clean up this stuff. And I feel like there's a good balance like that with CE courses as well.
Yeah. What did you take? What CE have you been taking?
I took the endo course through Dr. Buchanan.
Oh, nice.
Um, yeah, it was a really good course. I learned it basically changed my whole perspective on root canals.
Nice.
After I would definitely recommend it. It's not too expensive either. I think it was like $2,900
Okay.
for 1 weekend in Santa Barbara. Santa Barbara is also beautiful.
Oh,
So
yeah.
you get another bonus with that.
Yeah.
I'm also taking its implant course through Midway Dental.
Oh, cool. Okay.
And it's still ongoing right now. It's actually 5 modules long.
Yeah.
So I'm in the middle of that right now. So trying to get more into implants
Yeah.
now. So I was kind of curious as
Yeah.
why you stopped doing implants. So,
Yeah.
but no, it is there's a lot of anatomy there that it can be scary. So it makes sense.
Yeah, for me, and it's like I've tried a lot of things and sort of dialed in, what I want to keep and what I want to not do. I mean, I really love placing implants. I think it's phenomenal. It was more just like, if I'm gonna do this right, I'm gonna have to do this much more CE. And it was like I
Yeah.
would just rather, not have to think about it and kind of focus on, like I said, the general dentistry has been kind of busy, especially busy for us too. I think like if you're heading the implant direction and you like it, like I think that's awesome. I mean, a lot, like I said, like Tim Kaczynski, he's a big implant guy. He's a general dentist, and he's probably one of like the bigger, implant guys in the Detroit area. So
That's awesome, and that's the cool thing about dentistry, right? Like if you don't want to do it now, you can always
yeah,
take more courses later on and start doing it then, or
100%.
like you said, whatever you want to do, you can work 2 days a week and start doing
Yeah, right,
something
right.
else. So that was all the questions I had for you. So thank you so much, Adam, for joining us again. And do you have any closing remarks or anything before we end this interview?
Man, I wish I had something like profound or insightful to say. I feel like we covered a lot of good stuff, like stuff I didn't,
I think so too. Yeah.
anticipate talking about, which is awesome. No, I appreciate, getting to meet you and, being on the podcast, and, really appreciate you inviting me on like that.
Thank you guys for watching. I hope you liked that interview with Adam White. He is a super cool dude, and he has a lot of information. He's a very smart guy. If you have any questions for me or had any comments about it, please let me know in the comment section below, and we'll see you in the next video.